I've been seeing this type of exercise or stretch pop up a lot recently on the internet, and it's basically the one where you have the tennis ball or some kind of an implement against a wall. Your whole body's pressing against it, and got to get those yellow lines in there. Anyways, it's supposed to kind of stretch out the back or roll out the back or do myofascial release, which is fine, of course. Makes a certain amount of sense. But as always, there's a good way of doing these things, and there's a not as good way of doing these things. And if you understand the finer points of it, you can end up doing more of the good stuff that can come with it. Understand, of course, whether you need this or not is really dependent on understanding what's going on with your body. So figuring out what needs it and when is something you need to seek out a professional for. Not me specifically. I do this for entertainment because I'm so entertaining. So, in any case, really, really basic. As we put pressure and weight onto this area, as we back up our body on top of it, we put pressure on the tennis ball or whatever specialty item is designed for this. We tend to change the way the spine works. There's muscles, of course, we'll get into that, but we change the way the spine works. So generally, it's for flexion or a forward bend of the spine. So the same thing would be, here like this. They're a bit forward bent through the thorax. So we've essentially dropped down in this case. And when that's a situation, when we put that tennis ball on a vertebrae that's done that, we can actually nudge it forward. And though we wouldn't want it to be this straight, essentially we transition from one to the other, we wouldn't want it quite this straight, quite this extended. It can improve upon something that's a little too flex. Let's say you've got some shortened tissues through here. That's an anterior longitudinal ligament. Could be the ribs in the front holding it, something like that. But it will actually improve that flexion. If it's flexed, we can bring it into a little bit better extension. It's not a bad idea. Again, I wouldn't recommend this unless you have a situation that needs it, and I don't recommend it without supervision at all, but there's a purpose for it. Now, this is kind of limited. It's kind of limited because all we're doing is we're pressing. It's brute in a way, brutish, I will say, until we add in something called leverage, which is a really good idea when you know what you're doing, because it changes the way things work. So if we use the arm, which is a particularly long lever, we can change where that force is being applied. So in a really simple way, if we look at this from the back, so these are vertebrae here, that's a spine, that's a head, all that fun stuff. Understand that by placing the implement or the tennis ball, what's really a fixed point ultimately, by placing it, say, on one side, gotta get those lines in there. Hey, there we go. Okay, by placing it on one side, we stop it from moving on that same side. Again, it's a fixed point. It's a fixed point in space, to be more specific. And when we allow for that to happen, when we then go and move our body around it, left, right, forwards, and backwards, all that stuff, whether it's the arm or something else, you end up forcing, not so much forcing is the wrong word, but making it so that it's the opposite side that must move around that fixed point. That's how that works. And so, if it just so happens, let me just clear up a little bit of this. If it just so happens we've got some shortened tissues over here, you can actually make it so that even though you're not directly touching that one side, even though you're over here with the tennis ball, you're actually expanding these shortened tissues on the opposite end. Alternatively, of course, what a lot of people actually use this for is just softening up some of the muscles through here, just really basic myofascial release. That's not a bad goal, but of course, there's more to this. So anyways, when we start moving the arm around, when we take into the account of the long leverage, we've actually got a wider range of things that can be interacted with. So taking this arm, let's say up and around, we'll talk about that more specifically, we change the lines of pull. We change the way in which this arm can pull through into this area and significantly far down. As a common example, you can always say, oh, for sure, you can get to at least the pelvis because of the latissimus dorsi muscle, the lat muscle. So that leverage extends fairly long way down, at least into the pelvis. But by adding the tennis ball, by adding that fixed point, we actually change the area in which it's going to concentrate or focus on more so. Not completely, you can't avoid, making it go diffusely. The body's actually designed to do that. But it's going to make sure it stays in kind of this area. It's gonna focus it. It's gonna make sure it does at least that much. Now with that, we can be more exacting. Never perfectly exact, but more exacting. So, for instance, as we bring this arm up, this is called flexion, shoulder flexion, or humeral flexion. There we go. As the humerus goes up this way, we call that flexion. What tends to happen, not absolutely, but pretty confidently, it goes into more of an extended position in the thorax. So it goes from flexed to more extended, not completely flat, I'm exaggerating. But in any case, that seems to be a general rule. So if you need that motion, you should use this motion with the arm. If you need extension here, use that arm. Now there's a few reasons for this, and I'm just going to get rid of some of this to start with. Again, just clearing things up. There's a few reasons that happens, and it's usually coming down to fascial attachment points. So let's say this is the arm here. We're choosing the right. Always choose the right, don't know what it is. But as we bring it up into flexion, and I did that completely wrong. It's always a good start. So as we bring it up into flexion like that, so it's coming up the body like so. Understand that as we do that, we've got a few directions, a few orientations of pull. So from the humerus itself, we can always talk about the triceps muscle, which does go into the lesser tubercle, the inferior tubercle of the scapula. And then as we start to bring it up in this direction, because of course we get a bit of scapular rotation, we can say the lower fibers of the traps are engaged. So it's starting to pull forward. That's not all, of course, because there are more muscles in the front too. So as we bring this up into flexion through the humerus there, always remember that we have as well pectoral muscles in the front. So the deltoid, of course, is a factor, but consider that we've got a pec minor right in about there, and then a pec major, which is not orange, but hey, let's just go with it for now. There we go. So as we pull up and forward, we actually get a couple of different angles of pull. So from the front and from the back into the spine and into the rib cage, and that elevates all that up. And so we get general extension through the area. General extension through the area, but a little more focused because of our implement, our fixed point, our tennis ball in this case. Now another thing that usually works too is moving the arm in a circular motion. Again, you see this all the time when this particular exercise is done. So we take that arm, we not only bring it up into flexion, but we bring it around like that. Usually we combine those two motions and we circle the arm around. We make just a full circular motion, a nice, smooth, slow, and gentle circle, and this makes it so it engages a few more tissues. So looking at it from the back again, we've already engaged the lower trapezius fibers, but as we bring that arm around and across, it'll go like that if we're looking at it from the back. We start to engage the middle trapezius fibers, and then even, depending on range, of course, depending on where we're at, the upper trapezius fibers. And that actually takes us a fair amount higher up than you would think. Not a huge amount of pull in this particular position, but at least as high as the CT junction, the cervical thoracic junction. Remember, too, of course, they would be obscured, but we've got the rhomboids to pull through as well. And they go about, C6, 7, all the way to T4. So a fair amount of pull when we're bringing that arm across the body. So what ends up happening is we bring it across here, as we've explained, the scapula comes forward and around like this. And so that lengthens those rhomboid muscles and gives us a bit more of a pull on that thorax. What that will ultimately do as we bring that arm across the body, so it's going across the body, understand that it will rotate through the thorax. This engages essentially another plane, and so even though we're looking at this from the side, we can actually pull, same side as the arm, pull through in a rotation on this side. Now this can get very complex, and to do this really well, it's probably not, just a tennis ball. you want the professional opinion of. It's probably just not, not just the pain and the discomfort you're feeling. You got to see someone who really knows what they're doing, and they're probably going to want to engage that same maneuver in a very different angle. As always, I hope that made sense.